Welcome back. We continue to commemorate World AIDS Day that was marked just yesterday, and so far so good. We are absolutely loving the feedback that's coming. As far as this discussion is concerned, we continue the conversation and just trying to understand where we are as a nation as far as responding to HIV and AIDS, and what can we do as a community to even support those who are living positively with HIV. Still in studio with me is Dr. Lilian Otiso, who is the Executive Director from LVCT. Jane Maina is still here with us, a Counselling Psychologist, HTS. We still also have Charles Karuga, who is a person living positively with HIV. I've got some interesting stats that I will be sharing with you in just a moment from the UN AIDS. But before we went on a commercial break, we were actually talking about for those who actually have to live with the situation on the ground in terms as their relationship. And so we talked a little bit about that. And now I really would like to bring Karuga in on this one, because Karuga, I just mentioned that this could be a serious deal breaker as far as relationships are concerned. Yes, and for you, you're young. Yeah. You've got your whole life ahead of you, and this is a time to, probably be out on dates or whatever. So first of all, how are you handling that situation as far as the dating world is concerned? Or if you're married, that is. That could also be another, yeah.
Apparently, I'm not yet married, but I'm dating.
Okay.
So it's amazing because my partner is negative. That's the amazing thing. Because as the director said, once you are undetectable, where the virus is not detectable in the lab, but it's there, but it's dormant or weak. So the transmission rate is 0.01%.
Right.
So you cannot transmit to your partner. Again, that's what we use. But on the other hand, the use of the protection, most of the condoms, is very key. Yeah. It plays a major role in my sexual life. And the enrollment of the PrEP to my partner was something else that was so amazing, because it's safe. It's a guarantee that she's safe. Yeah. That's how it works for me.
And so how did she respond when you actually told her?
At first I was nervous because I didn't know how she would react. It's weird telling someone, hey, una date mtoko positive, Yeah. It's weird. So I niliamua to let me brace it up and tell her. Yeah. But the amazing thing is that she was very
She was okay.
Cool.
She was
like,
okay,
she was very cool.
All right, I understand.
I don't care as long as I love you. It's you I chose, not the virus.
Well, that sounds like someone who's very woke. And I think we'll talk about this over the break, that the perception of what HIV and AIDS looks like to people is very different for each person. What I picture what HIV looks like versus what you think it is varies from person to person. So she, her perception, obviously,
I think that's a major thing for him, and even the couple. I congratulate the girl.
Yeah,
she's lovely. She's a cool girl. And I think, like I mentioned before, stigma will come because if she had perceived HIV as something totally bad and different, then maybe she would not have accepted. But she has probably seen a picture of a person who has HIV but doesn't look emaciated. But you see, discrimination and stigma comes in when people know or think about pictures and the kind of photos that were being shown when we were growing up, you would actually even fear. People who are coming to do talks in our high schools would be a person who is, you're thinking the next minute he's dying. And that is what actually made us even fear. Actually, it affected most of us in terms of even dating and growing up, and you would actually see sex as an abomination that time, because that was the only way we knew that this HIV is transmitted. But now with the new knowledge and information about that there is transmission from a child, like he said he was born with it over 20 years ago or thereabout. And now we know that it is not his mistake. So then this new knowledge and this information that people have about HIV and AIDS, about HIV, then brings out a different picture. And that reduces the stigma at the end of it.
Dr. Lillian, I said I was going to share some stats. UN AIDS actually says that 770,000 people by the end of 2018 died from AIDS-related illnesses. And let's talk a little bit about the mortality, as far as these related illnesses. When you talk about opportunistic infections, can you expound a little bit on that, that we can get the full scope about what someone with HIV or AIDS is dealing with.
Okay, so the most so as I mentioned, the virus would cause your immune system to be suppressed in such a way that diseases which the body used to fight naturally, that most people whose immune system is functioning would fight naturally, now start acquiring those diseases. The most common one is TB. So TB is one of the leading causes of infection and even death among people living with HIV. So that's one of the things that we even screen for and try to treat. Then now the others come in, and as you go along, like you get fungal infections that were not so common, that occur naturally. So we have like candidiasis, and now you start seeing it in the mouth. You also have what we call cryptococcal meningitis. So you start getting severe infections like meningitis, some eye infections, but those are really late in the disease. But very early on, we start seeing TB, as I mentioned, maybe pneumonias, or just skin infections. There's a lot of skin infections. So those tend to come, the more sick you get, the more you get that. And even some type of cancers, like what we call Kaposi sarcoma, they come in people who have not taken their treatment, and some severe forms of pneumonia as well.
Okay. When we talk about antiretroviral treatment, how do the drugs ideally work? Explain that to us. And, you know, when you talk about someone taking their treatment, what is it?
Okay, so the antiretroviral drugs are drugs, and they're drugs which were developed to try and suppress the virus. So far, we've not been able to cure or eliminate the virus from the body. So what happens is some of them work by stopping the virus from entering the body cells. So how the virus works is it infects one cell, it multiplies within that cell, bursts out of that, and goes and infects many more. So you can imagine one entering one cell, giving birth to millions of viruses, and then they burst out and infect others. So what the drugs do is you stop that multiplication in the cell. So it might enter the cell because now you're infected, but it doesn't allow it to grow and burst out. That's one way. Another way is there are others which stop it. If it has burst out, it cannot enter the new cells that it's going to infect in the body. So that's basically how it works. And the best way is you don't take only one, you take a cocktail of 3 drugs, so that they work at different levels to try and stop the virus from infecting cells as much as possible.
Okay. And what is your day-to-day routine like? Because when she says you've got to take 3, you know, what are we talking about in terms of your dosage? And explain to us.
For me, I think they were combined. So I only have to take 2 pills once a day. Maybe at 10 p.m. After every 24 hours. So cool.
Is it exhausting?
Unlike before, it was too much exhausting. The pill burden. Is it down
the pill burden. Like that.
And then it was twice a day.
But
now with the new treatment, it's once. Okay, although it's you know, the funny thing with HIV, it's not painful. So you even wonder, why am I taking these meds? You know, you're not feeling any pain. Even if you miss, you're not feeling any pain. But the reality is, the moment you miss one pill, the multiplication will begin. So it's important to adhere to these meds on a daily basis. Have you ever forgotten to actually take your dose? Yeah, back then in high school, I was a bit... I was getting bored with these meds, so I would skip
because you're
them.
Not seeing anything happening, so what's the point?
It's not even hurting, so I would miss them around a whole week, and it's cool, but the results came later. My viral shoot, it went high to 40,000 copies per the blood mLs, and, and the infections, I started knocking like the TB, you know, and then I decided, why torture myself? I can make a change, so I decided to take that bold step of adhering to my drugs, and now here I am, undetectable, suppressed. It's amazing.
Okay. Alex from Embu is on the line. Let's hear what he has to say. Good morning, Alex. Good morning.
Good morning.
Yes, Alex. Karibu sana to the show. Please speak up so that we can hear you well.
Okay.
Yeah. Go ahead. Do you have a question or a comment?
Yes, I have a question.
Yeah.
Concerning the topic today.
Okay, go ahead.
I wanted to ask, what if someone knows he is positive and And he got it out of, what will I say now? Yani kama mtu wako anajua.
Okay,
You just met someone, you started dating.
All right, Alex, I think your line seems to have a bit of an issue. Unfortunately, we can't hear you, but we hope that you will be able to reach you so that we can get to your question, and we'll leave our team in the gallery to handle that. But going back to now, you know, when we talk about you living this reality, Jane, yes. Tell us about, you know, with your counseling services, how people respond to this and, you know, the challenges and the concerns individuals will have, you know, at your clinic or at your office. What do they tell you? Because you can imagine taking a pill twice like he used to, once every single day. It's taxing, by the way.
Yeah. The drug burden he mentioned.
Yeah. So this shift in lifestyle.
Yes, the shifting lifestyle, yes. And I think before, depending with where the viral road is, and Dr. will be able to shed some light on that. I think during the first times or the first days of your testing, I believe the viral load is usually very high.
Yes.
And so then the medicines are usually many. So when you talked about the load, then it's actually, there were people, when I remember one client I was handling, she used to take about 14 of them twice in a day. So that's about 28 of them. So she would tell me that there are times that she would smell the drugs all over. She's walking on the street, she would smell like everything. It is coming out of her.
Right.
And of course now, as a counselor, finding stability is my core business. So I want to find and try and make peace.
Right.
Allow this person to make peace with whatever it is. Because then we're asking ourselves, is there any other way besides just taking these drugs? What are some of the effects of not taking the drugs? And you would walk through. I like what Charles is saying, that it is actually a choice that you have to make from actually within, not without, but from within. Right. That you have to know that in order for me to live, then I have to faithfully religiously take my drugs, so that if I don't take my drugs or if I don't take my food as drugs, then I'll be forced to take drugs as my food. You know, you can use that interchangeably.
Absolutely,
yeah. And so then the issue of the drugs will probably come in very handy in terms of counseling. So they will come complaining that, you see, counselor, I cannot continue like this. And I'll throw the question back to them. So how else do we go about this? Is there any other way out?
And I can imagine there are probably some who have even had suicidal thoughts. Because of the results that came out.
It causes a lot of mental issues in terms of depression. You will first and foremost, you'll have to get depressed. You'll have to have some mental unstableness and that kind of a thing. But the bottom of it all is that counseling is very productive.
Right.
It is very, very productive because then you walk through with the client and help them to be able to be stable. And that brings some very nice feelings with the client.
Right. Okay.
We call it catharsis.
All right. Getting back to you, Dr. Lillian, on some of the stats that I wanted to even share with you. And let me start off with the key populations. I believe I saw from UN.org that gay people or men who have sex with men are part of the group that are actually 22 times at risk or higher risk, have a higher risk 22 times more at, you know, acquiring HIV/AIDS, or rather HIV. So what can you make of that, and tell us why that specific population or group, right?
Okay, so we've known this for a while, and a lot of infections are driven by the key populations, especially men who have sex with men. Like in the West, in Kenya, we say we have a generalized epidemic with some concentration in key populations, including men who have sex with men. So what happens is that the kind of sex they have, the anal sex, the risk of acquiring HIV through anal sex is a lot higher, like 30 times higher than heterosexual sexual contact. So that puts them at risk. So for that reason, to protect them from acquiring HIV, they need to use condoms regularly and lubricants because of now the risk of even tearing the condoms. So that's something that is required. And now the other services like PrEP, which I talked about earlier, have been shown to really reduce infection. But why this population is at most risk is because it's a stigmatized population and criminalized. So there's a lot of discrimination and stigma around being gay in countries like Kenya. So the result is that the gay people, the men who have sex with men would hide and not want to seek services because of the fear of the stigma. And when we talk about if it's a crime and someone wants to take you to jail, then you want to hide. But they're still going to have their partners, but it will not be, they will not have protected sex in that case.
True, yes.
So that's why in terms of programming, that's a population that we really look and work with, working with fellow MSM who will identify others, make sure that they get the right treatment, and provide the dignity that is required and avoid and mitigate against the stigma that makes them not seek services.
I've had quite a number of panelists on this show, including even sex workers, who've talked about how this is even a human rights issue, that they cannot get the services that they need because either society does not accept them or, of course, it's against the law, you know. And so what ends up happening, you've got people not visiting their health centers, and now it becomes a problem. But going back even to what we have in the papers, our very own First Lady, Margaret Kenyatta, you know, was actually speaking just yesterday. She was at Gusii Stadium, and, you know, she talks a little bit and was stressing a lot on women actually going for antenatal clinics, because this would, of course, improve the situation and hopefully will result in HIV-free children. And so maybe you can give us your thoughts on that, especially for those who are watching, also expecting why it is so important to be going for your clinics. But before you do, we've got a caller on the line. Good morning.
Morning.
Good morning. Yes, Miriam.
Yes.
Yes, karibu sana to the show.
I'm asking.
Yes.
There's a gentleman there who is saying that the HIV, it is undetectable. I'm asking, can he infect somebody who is not HIV positive? You know, when you are tested, you are undetectable, isn't it?
Right.
Now, if she gets a girlfriend who is not HIV, you know, and they go to the testing place. Right. How, you know, he's saying that the HIV is undetectable. Yeah. Now, how will you know, if she wants to marry, I'm sorry, if he has married, it is okay. But if he has not married, he wants to marry. And you know, nowadays you go for the testing. Yeah. How will the partner, you know, how will it be? Okay. All right, Miriam, we did address that a little bit earlier on, but of course we can repeat for the sake of our viewer. Do you want to start off by your experience, because Daktari can explain further what you meant by not detecting your viral load? Yeah. Again, to Miriam, as I said earlier on, and as Daktari said, the moment you attain the undetectable viral load, the transmission rate drops to 0.01%. Yeah. So it's you cannot transmit, and I've done it, and I've done it for the last 4 years, because I've dated for the last 4 years, and we've been doing it, and she always turns negative after every 3 months of test. So it's something that I've seen, and it's something that I've done. Yeah. Okay. So I think that covers it, right? You've answered that question. Now, going back to this article, Daktari, I don't know if you managed to see, you know, what First Lady was talking about. Of course, you know, she's at the forefront of maternal health, yeah? And so she's talking about HIV-positive pregnant women lacking access to antenatal care. So just your thoughts, you could, you know, expound a little bit on that. Okay, so as I mentioned earlier, how we prevent babies of HIV-positive pregnant women from acquiring HIV is making sure that they seek treatment. So the first thing is to be tested. Right. So as a country, we try and test all pregnant women. If you come to the hospital, of course, we try and make sure that you get a HIV test as soon as you present. Right. Because we have seen that once you give antiretroviral therapy to this pregnant woman, and she attains the undetectable status of the viral load status, then the chances of transmitting to the baby are reduced significantly. And the earlier a pregnant woman comes to the clinic, the better. In Kenya as a whole, HIV positive and negative women accessing antenatal care comes late. People come in the second, even third trimester. But we want people to come early so we can provide the treatment, and it works best. Then when we repeat the test towards the end of the pregnancy for those who are negative, to make sure that we catch all the pregnant women who may have acquired HIV during the pregnancy, to prevent that. Then when the babies are born, we also give them the antiretrovirals to prevent them from acquiring until they stop breastfeeding. So that's what we're doing. So
the best way of doing this is to encourage all women, if you're pregnant, come to the clinic, and not once. We actually say at least 4 times, but even up to 8 times, whether positive or negative. So we can offer a range of tests that protect the mother and protect the baby.
Okay. All right. Sam is on the line. Good morning, Sam.
Good morning.
Yes. Do you have a question or a comment?
I have a question.
Yes. Go ahead.
Yeah, nauliza.
Yes, go ahead. Sam, unatusikia?
Hii ugonjwa ya hii testing.
Yeah.
Mi nilifanya hiyo set. Alafu after kama 2 weeks nikaanza kuanza kukojoa uchungu. Hiyo ni inaweza kuwa ni hiyo ama?
Okay.
Yeah.
Okay. Asante sana. Did you hear what Sam had said? That he actually went for testing, and 2 weeks later, symptoms started to, you know, occur. So he's asking, could it be that? Could it not be that? Daktari, why don't you take it away? Because I want to believe that's, you know, pretty much what he was asking.
Okay, so there's something called window period.
Yeah.
When we test for HIV with the rapid tests, we're testing for antibodies in the system. So these take time to form, or to form to levels that can be detected by the test. So you can come for a test today. Let's say you were exposed yesterday. The test might be negative. But within 4 weeks at most, you should be able to confirm the test with a repeat test. So if he feels he was at risk, he had been exposed to HIV, he had unprotected sex with someone he didn't know, then the chances are that he could be positive if he was at risk. So he should go back for a repeat test within 4 weeks to confirm his status.
Okay, we've got another caller on the line. Good morning.
Hello, good morning.
Good morning.
Yes, good morning. My name is Betty.
Yes, Betty.
Now, I see there's a lady who's called Miriam who has just called.
Yeah.
And I believe maybe her question was not, it didn't go through correctly. I think what she wanted to ask, and I'd also like to ask again on her behalf is, there are people who are undetectable, yes?
Yes.
Assuming you're dating somebody whose status you don't know yet, and you both go to get tested, and because it's undetectable, his might also come out negative.
Yeah.
In this case, how would you know that the person that you're with is somebody positive but undetectable if they're not willing to share that information?
Okay. All right.
Yes.
Would you like to take that?
Yes. So the HIV status does not change because someone is undetectable. It still remains HIV positive.
Yeah.
And most tests can pick that. We've seen a few cases where maybe the test may not pick that after someone has been on antiretrovirals, but most of the time it can pick that result.
Okay.
So the truth is when they go for the test, it will still be one positive and another negative.
Okay.
But in the case of Charles, as he explained, he was already positive and he informed the partner that he is positive. The most important thing was for both of them to get tested.
Yeah.
And then for the negative partner, if she's confirmed negative, to be put on the protective, the PrEP, and now to also get the advice on how to stay negative.
Okay. Jane, is the issue that a lot of people just don't want to disclose what's going on?
Yeah.
So that is the bottom line here, that couples or people just don't want to let the other person know their status. And then again, how do you even go about encouraging couples to go together to LVCT?
It is important for people to be encouraged to probably disclose.
Yeah.
And one of the things that you help them to do is to be able to come out clean about their HIV status. Yes, I'm liking what Charles mentioned, that yes, he's at a level where it is undetectable, but he knows that he's positive. Because you can imagine if a person doesn't know that he's already positive and he's at a level where he's not detectable, he can choose not to say.
Right.
But then if he would go to a counseling session and he discloses, of course with confidentiality observed, and he discloses to the counselor that he is HIV positive, then the encouragement here is that please ensure that you tell your client this. Because then as much as I would know as a counselor that my client is positive, I don't have any obligation to tell the partner that, you know what, this boyfriend or this girlfriend that you're dating is HIV positive. So as much as possible, I encourage my clients to be able to be the ones to speak to their clients about their HIV positive status. Yes.
Okay, okay. Yep. And as you can see in Karuga's case, that at least worked out for the best. As we're winding down, I also want to throw something your way, Dr. Lillian. 8.1 million people did not know that they were HIV positive by the end of 2018, and this is according to the UNAIDS.org site. As we're winding down, let's just talk a little bit about the timeline that it takes for someone to actually understand, uh-oh, something is a bit off. Because how is it that you are living with it and it's undetectable very quickly as we're winding up, please? Okay,
so the HIV virus is not like Ebola, which comes suddenly and shows symptoms. It can take 2 years, it can take 10 years for symptoms to show. So that's why the message here is that if you feel that you've been exposed, you're at risk, just take a HIV test. Because by the time symptoms come, it may be very late, you might be very early suppressed. So know your status.
Okay, know your status. And I think that's the message that we're going to leave our audiences with this morning. It is important to know your status. Make sure you actually pass by the closest clinic or even at least the closest health center. The likes of Dr. Lillian and her team are also available to actually help out people who do want to know and take charge. And so I want to thank you so much, Karuga, for sharing your story. That's all the best. Of course, don't be a stranger. Thank you so much, Jane, for being here with us. And of course, Dr. Lillian, a big thank you to you as well for taking time to be with us this morning. Speaking about the youth gentlemen who also need to be sensitized, I think there's also the need to come up with creative ways to pass the message. Last time we had the king of condom here.
Right.
And he was flashy and fun and, he's such a friend to the youth.
He gave you like 3 packets of...
and he gave you like 8. I wonder what you did with those.
Well, as these two do their condom count, we'll have to bring the show to a close on that particular point. Thank you so much for coming and sharing your stories, and of course for more insights on that you can pick up that conversation online as well at K24 TV. You have got to say bye-bye. Have a great day. We'll be back tomorrow bright and early. After us, it's a daily brief up next. Have a great day. Bye.
Okay, bye.